us today. We have Dr. Phan, who will be sharing with us how she entered into the career of pharmacy and a little bit about her job and her background. And interviewing her today, we have one of our pharmacy students, Eric Pham. Without further ado, I'll turn it over to them to start.
Hey, how y'all doing?
Hey, how are y'all? So Dr. Phan, can you tell me a little bit about your background, where you're from, and then your colleges you've attended?
Yeah. So if you can't tell from my voice, I'm clearly not from Mississippi. So I'm originally from Virginia, and so on the East Coast, and I'm from Northern Virginia, which is about 40 minutes away from DC. And I went to undergrad in Richmond, Virginia at Virginia Commonwealth University. And then from there, I decided that Richmond was no longer good enough for me, and then I moved to Baltimore. So Baltimore, Maryland, and that's where I went to pharmacy school. So I went to the University of Maryland in Baltimore. And then, so I stayed in the Baltimore area, and then I did my first year of residency training at Johns Hopkins. And then I came down here for my second year of residency, and I haven't looked back. So I had the opportunity to stay on. And I'm sure we'll talk about it a little bit more later, but I am a first year clinical assistant faculty member here at the School of Pharmacy.
Awesome, thank you. So what got you into pharmacy, and who were some of your biggest influences growing up?
Yeah, so I think overall, I didn't have too many family members that were in healthcare. My older sister is in healthcare. She is an emergency room doctor up in New York. But I have a pretty big age gap between my siblings, so I wouldn't say that was like a major influencer on what I wanted to be when I grew up. Still trying to figure out what I want to be when I grow up. No. So, but I think, in high school, actually, when we all have to take the PSAT, I don't know if you remember taking that, if that's a distant memory now. But on my PSATs, I remember they ask you what major you want to do, like at the end, and then they use it as like a marketing tool, and they send you a bunch of things. And so on that, I actually put photography. And I remember, getting all the like materials for that coming in the mail, and my mom was like, what are these? Why does it say art school on them? Like, what did you do? What'd you put? How are we getting these? And I was like, oh, I put photography on my thing at the end of the PSATs. And she was like, yeah, that's a hobby. So you need to pick something else. And I was like, okay, I think I can handle that. So I think once I got to undergrad and I had a bunch of different opportunities, I actually started, just like any other college student, I was trying to find like a job over the summer to, fund my shopping problems. And I came across a job at home at a pharmacy. So I started working at a pharmacy, I would say probably my freshman year or sophomore year of undergrad. And, the thing that I really enjoyed about that was just the opportunities that I got to interact with people, not just like, the upset people occasionally, but then there were the people that are really appreciative of the services that we offered, and just the communication that we provided to them regarding their medications. And I think also, deep down inside, I kind of loved reading all the pamphlets that came out of the printer on like how the medication worked, what side effects there were. And I think that really interested me in terms of just, I don't want to say be nosy, but kind of be nosy in terms of like, oh, this person's getting this medication, this is how it works. And I think from there, I was like, wow, that's so cool. Like that, such a tiny pill or capsule or, tablet can do so many things. It can really help a person or it can really harm a person. And I think that was where it all started, working at that CVS at my hometown. So I think that was definitely a big influence on why I wanted to pursue pharmacy. And I think, a lot of mentors along the way, I think, play a lot of various roles, not any too specific that I can think of, but I think for sure my pharmacy manager at that first job, in terms of the way that she cared for her patients and, how she would go like above and beyond. And I was like, I think, when you're looking for a career, you're like, I just want to help people. But when you get to actually see it and you see a pharmacy manager, like, I don't know, spend the extra 30 minutes or, go out of her way to pick up medications from the aisles for the patient when that's not necessarily her role, but she does it with a smile. And I think that's some of the things that through my experiences where I'm like, you know what, that's what I want to be when I grow up, and I want to embody that. So
Hmm.
yeah.
Okay, so yeah, a lot of the exposure from the beginning, being in the pharmacy right away. So would you recommend, maybe students interested in like working as a farm tech in undergrad years?
Yeah, so I think any work experience, I think it's still a good experience because then it can help you roll out or roll in what you like. So I think you don't necessarily have to work in a pharmacy. I think that helps. And I don't think that really, it might have changed my experience somewhat like through pharmacy school, like having the opportunity to work at a pharmacy. But I think overall any job experience is fine. And I think it's just additional confirmation if you do have the opportunity to work at a pharmacy.
Awesome.
Do you work at a pharmacy?
Um, I do not. I work
Okay.
in the pharmacy school office in Oxford.
Okay.
So
Well,
working
would you be
alongside,
interested in?
I would be. I would
Okay.
be.
Yeah, and I think it's not just your typical like, oh, I need to work at a CVS or a Kroger or Walgreens. I mean, there are different roles that you can have, whether it be like specialty pharmacy or, I worked at a hospital when I was a pharmacy student. So I think so many people are like so attached to like, oh, I got to work at like a CVS or a Kroger, and like there's so many unique roles within pharmacy. So like you said,
Hmm.
I mean, a unique role in itself is working in the office, and like you learn so much about pharmacy too that way. So I think, like I said, a job is a job. So I still
Yeah,
think,
and I learned a little bit more on the academia side
yeah,
within pharmacy and the admissions process with that.
yeah,
And then, yeah, like just the exposure, I did a lot of shadowing in clinical pharmacy. I went to Batson and Le Bonheur and just like got exposed to if I really did want to go into pharmacy or not
yeah.
before I
And
went straight in.
yeah, and I think that's a good point to bring up too is shadowing. You can do that. Like that's free. You don't have to like, send away your whole summer. And you
Hmm.
can just do a few experiences and make those connections with pharmacists and like, pick those pharmacist brains too and be like, hey, like, why did you get into this? Because everyone's reason is different.
Right, for sure. All right, can you tell us about your first job as a pharmacist and or your favorite job?
My favorite job is obviously this job. No. So I guess my first job at a pharmacy would be um, that one that I had as a student, but my first pharmacist job would be my PGY1 residency. So I did a community pharmacy residency. So I worked in the community setting. I did a lot of specialty pharmacy, so those high cost meds. There was a lot of monitoring that went with it. So I did a lot of that. And then also, one of my favorite parts of my first year of working as a pharmacist would be the home visits that I got to do during my residency. So it is exactly what it sounds like. So I got to go into patients' homes and kind of meet them where they're at. And I think with being in, inner city Baltimore, I learned so much about, meeting a patient where they're at in terms of, there's a million reasons why a patient can't take their medication. It could be they don't have the resources, they don't have the help, they can't access it even within their own home. Maybe like the refrigerator's on the first floor and they don't have a way to get to the first floor from the second floor. Or, you learn so many things when you enter a patient's home. So I think I learned a lot about patient barriers and just how to work. I mean, not all of them are solvable, but at least when you can see them, you can be like, oh, well, keep this in mind when I'm counseling a patient, or when I ask them to take yet another medication or something like that. So I think it just brought a different perspective to the world of pharmacy for me, having the opportunity to do that. So yeah, so I think that would be the highlight of my first year of working as a pharmacist.
So you did mention your PGY1 and PGY2. Did you know you always wanted to pursue a residency
Yeah,
in
so
pharmacy school?
Yeah, so like you said, I did shadow a lot of pharmacists myself once I got into pharmacy school. And one of the first pharmacists I shadowed was a pharmacist that was a faculty member, and she worked in our anticoagulation clinic. And again, I think what always has kind of stuck with me was like the ability for pharmacists to interact with people. And, even when I was before I entered pharmacy school, that was still something that I was like, wow, that's so cool. Like, I mean, it's such a simple task, but I think you learn so much about a person when you just get to interact with them, whether that be every month or every 2 weeks or whatever. But I really appreciated that. So this pharmacist that I shadowed, she did the same thing. She had great rapport with her patients. She, knew so much about their life. I don't know how long she's been seeing all of them, but I was like, oh, this is a interesting like environment. And, she was independent in her practice. She, didn't have to ask anybody to change doses of medications, or, she made her own decisions on when the patients would come back. And I was like, I like this. Like, I like the level of autonomy, and I like that she still, got to be a teacher the rest of the time. And I was like, oh, that's so cool that you can still have the opportunity to, teach students and then also like interact with patients. So you're not really losing anything, and every day is different. So she was one of the first pharmacists. And from there, I think that was kind of my first experience in figuring out what I wanted to do. And after learning more about that, I knew that, in order to get to where she was at, I would at least have to complete a year of residency. So, and then after that, specializing within ambulatory care, which I know we'll talk about a little bit later and what that means and what that is, but that usually requires a second year of residency. Not always, but I think, why not, in terms of you have the time, you're already making $0 to nothing. So why not invest the time in terms of, being more comfortable, being more independent as a practitioner, and just gaining more skills. So I think there's benefits to pursuing residency training or just additional training in general. And kind of a segue, but anything that we can do to elevate the profession of pharmacy, I think we can do that through additional training and making ourselves better practitioners.
Right. And it's progressing so much that everybody's having to be more competitive and do all that.
Yeah, and I think too, like I said, like it's not just a residency, you can do anything. Like it could be a fellowship, it could be whatever, work for the FDA for a while, or do some kind of fellowship that way, or do managed care. There's so many things that you can do. So not just a traditional pharmacy residency that we all think of.
Right. Yeah, we just had our IPPE virtual, and we had to look through the ASHP site for all the residencies, and it was like hundreds.
Yeah, and there's
we were
so
like,
many.
how are we gonna narrow it down later in the future? Like, there's so many.
Yeah, and that's the exciting part, though. Like, you're in an exciting time where you can be like, I don't have to like pick one thing yet. I can just try them all.
Exactly. So can you tell us a little bit about what area of pharmacy you currently practice in?
Yeah, so I currently practice, like we said, within ambulatory care. And I think, a lot of times we get mixed in terms of what exactly that means. But to me, that just means seeing someone in a clinic setting. And I have the ability to, change up their meds, require labs to be ordered, counsel them on medications, ask them to come back within a certain amount of time. So I think it's just a little bit different from the community setting in terms of that I have direct relationships with the providers that these patients may see. And, I have maybe a quicker ability to change the meds or ask for labs to be ordered, or, counsel patients. Whereas I think in the community setting, you have a big role within education, and the medication is already prescribed and you're counseling on that, as opposed to for me, I may play a role in deciding what med is prescribed, or I might help them weigh the benefits and risks of different meds. And I also help with like barriers with medications. I think by the time you get to the community setting, it's like, oh, it's not covered. I guess I have to call your doctor's office and we'll figure it out. Whereas within my setting, I might be like, okay, I'm going to send this in. Okay, it's not covered. Let me fix it real quick before the patient even realizes that they can't get it. So I kind of like that because it's the best of both worlds. I get to educate. I get to, build that relationship with patients over time, and I get to decide when they come back. And I really get to, like a lot of people say, practice at the top of their license. So, making those therapeutic changes, really utilizing that literature that you learned, or where you're like, oh man, my teacher's making me read this again. So like utilizing that. So I think that's an exciting environment to be in. And so I see kids and adults, which I think is also very interesting. I think a lot of pharmacists either see one population or the other, or they just really specialize within an area, like whether that be, like, infectious disease or cardiology or oncology. But for me, I get a little bit of everything. So I guess that kind of goes back to like, I didn't really have to decide what area I wanted to specialize in. I get to be kind of like a jack of all trades in terms of chronic disease management. So I'll see anything from like pediatric asthma, pediatric, diabetes to I get to help with Alzheimer's and, the dosing of their medications or reducing the dose because it's causing problems with their chronic diseases or depression or COPD. So literally anything. And I love that because it's like, I don't know what I'm going to get today. So let's just find out, come to clinic and, utilize my skills that I have. So.
So you really do have the whole patient population
Yeah.
All around.
Yeah. And I love it. It's fun. And I don't know if you can, tell, but I definitely do enjoy what I do. And I feel like I'm making an impact.
Awesome. So I guess the next one is a two-part question with that. What do you love most about the pharmacy profession, and what do you find most challenging?
Yeah, so I think what I love the most, I feel like there's a lot of things that I love, but I can break it down. So I think the first thing is just the, I guess the capacity in which we can see patients. I think we're, depending on what setting you're in, but usually we're kind of the last people to see the patient. So we get to make that biggest impact, right? So I always like to think of the community setting. Like they're probably not going to see anyone for a while after they pick up that prescription. Like they'll be back in 30 days, but between that, we don't know what's going to happen. So I think we just play such a major role in a patient's, healthcare. So I think that's one of the things where is one of my favorite things. And then secondly, I would say just the variety of things that you can go into. Like I said, like we were talking about earlier, like literally you can do anything and it's so hard to narrow it down. So I think a lot of people have a different perception. They just think of pharmacists as like dispensing, people, but with modern technology and everything like that, that's no longer really just the role of a pharmacist. We can do so much more than that. And I guess my kind of a short beef with that is like when people are like, oh, I'm a clinical pharmacist. I think all of us are clinical pharmacists. We all have the same degree. We all have a doctorate. So I don't think it's necessarily appropriate to call someone a clinical pharmacist to elevate anyone. We're all pharmacists and we all take care of patients. So that would be my second thing that I like the most about pharmacy is the variety. And then I would say the third thing would be, I guess this is kind of a personal thing, but in terms of variety of jobs, I like that we can go into academia and kind of mix those worlds in terms of having the opportunity to work with students and kind of bring up the next generation of, student pharmacists. I guess that's not really as specific because you could probably say that about any health profession, but I think for us, there's something special about interacting with student pharmacists. So that would be the third thing. And then what was the second part of the question? Sorry.
Challenges that you face.
Challenges. I think that's something with a pharmacist is that with any challenge, we always try to find a solution. I think that's a strength of our profession as a whole. So I won't say there's any one challenge that I can think of. I mean, maybe as my time so far as a pharmacist, I would say, or recently, I know we're going to talk about this in a second, but like maybe just getting built, recognized for the work that we do. So for example, I'm a big advocate for, I did the service, so I should get reimbursed just the same as someone else that would provide the service. So within my clinic, both of my clinics that I work in, I've been trying to kind of advocate for pharmacists to be able to bill because I can put in the codes, but we just won't get anything back because we're not recognized as healthcare providers. Whereas like a nurse practitioner that performed a similar service could get money back. So I'm kind of like, but I went to school for longer and I did 2 additional years of training. Like, I don't understand why I'm not equal. So I would say that would be a potential challenge. But like I said before, we're all about solutions. So, that didn't stop me. And I found someone in the medical system in terms of like that would credential a pharmacist, and I'm working on it and I put in the codes and we'll see if we'll get paid. So yeah, and I guess kind of to flip the question on you, what's something that you like so far about the profession of pharmacy since you just started?
I really do like the variety as well. And it changes for me constantly of what I want to do. So I've had pediatrics up there with clinical and now intensive care, and then academia as well,
Yeah,
for similar reasons. And just seeing how, like, interacting with the orientation team of like the new early entry and pre-pharmacy students who come through, and knowing how I can help them already, like in my position, and seeing how that continue in the future
yeah.
post graduation and residencies.
Yeah, and that was kind of going off of what I said in terms of like just bringing up the next generation of student pharmacists. Like, although you're currently a student pharmacist, like you can always help someone who's wanting to be a student pharmacist. So I think that's just something cool about our profession, is always willing to, help someone out to get, to get them to where you currently are.
Right. And I see that within just our class alone, our pharmacy class, and then like all the pharmacy school faculty members who are willing to help along the way, makes it so much easier. And the networking we have within our school is pretty awesome.
Yeah, great.
Um, Almost wrapping up, can you tell us a little bit how COVID-19 has affected your work, and schedule?
Yeah. So I guess the biggest way that it's affected it is that I can't go to my office, which is really sad. And I mean, it doesn't matter. I don't really need my office for anything except for I do love my double screens that I have in there, and interacting. I think a big part of what you're saying is that like we love to interact, right? As pharmacists, or most of us do. There's a job for everyone, but I think they're taking away that ability for us to just say hey in the middle of the hallway to students or to our colleagues or to Noel or anything like that. That part is a little bit sad, and I can't wait till we can get back into our offices. But in terms of clinic work, I've still been going to clinic throughout all of this because I think chronic diseases still persist even with COVID. So there's still a need
Mhm.
for me, and I've had to switch a lot of my practice or a lot of my visits over to telemedicine, which is not a problem because we have the resources to do it at UMC. So that hasn't been a problem. And it's kind of fun because when you'll switch an appointment over to telemedicine from an in-person visit, our nurses will call our patients and they'll be like, oh, like, it's just like FaceTiming with your doctor. So, if you have something to FaceTime them with, we can use that. And I think that's been really good for some of our patients because some of them may have transportation problems, but they do have some sort of smartphone so that we can still see them. And
Right.
I think that will change our profession as a whole moving forward. And when I was talking earlier about the billing stuff, actually I have been able to bill for these telemedicine visits. So if they continue with allowing these billing codes to be used because of COVID-19, I think that will be a pretty big step for the profession of pharmacy as a whole.
Oh, that's good.
Yeah.
To wrap up, do you have any advice, for incoming freshmen or graduating seniors who are interested in
Yeah.
pharmacy?
Yeah. I'm also going to flip the question on you, but since I'm sure you have great words of wisdom for our incoming freshmen. But I think for freshmen in general, I think never counting out what a pharmacist can do. I think also sometimes people are like, oh, like I might switch over to a different health profession. But I think there's something special about pharmacy, like we've said throughout this whole conversation, the variety, the level of patient care. I think when you're considering a health profession, I feel like we're right up there with everyone else. So, I wouldn't mark out pharmacy. And I think just being open-minded, like you said, since you have, like you said yourself, Eric, that we have so many opportunities. So like, just, trying to weed through what works for you, what doesn't work for you, but always keeping an open mind, I think is very important. And I think in the difficulty of the program in terms of you're studying a lot, I think just remembering like why you decided to do this in terms of you wanted to help people or whatever your reason is. I think always remembering that reason when
Hmm.
the times get tough, like, oh, I got a C instead of a B, or whatever. But like at the end of the day, no one's going to ask you about that C. Like I don't think anyone's ever asked me about my grades beyond residency. Like, I don't really think it matters. It shouldn't define who you are. So remembering that. And then in terms of graduating seniors or fourth years, I would say always keeping your mind open, but in a different way, in terms of just always trying to keep up with the profession of pharmacy and always kind of pushing the upper limit in terms of what your innovation can be, what information you're given out there to our patients or to the world of academia, like always kind of challenging yourself to be a better pharmacist and keep up with that information. And I think another piece of wisdom, and I think too, is like have a life outside of pharmacy, like have an identity outside of pharmacy. So like, yes, first and foremost, you're a pharmacist, but like, I don't know, I'm also a foodie, or I love to travel, which has kind of been under wraps right now. But, you can be a foodie from your home, or like in your case, maybe a baker at home. So, making sure you have hobbies and other things that you can identify as outside of being a pharmacist, I think is important. So I guess what's your advice for income?
Mine, making sure you have the support system, both your family and then the friends that you make. They're super important to keep you accountable throughout your school. Like you said, remembering your why. I remind myself all the time, like, after 3 exams in a week, it's like super hard. But if you keep remembering your why, and then taking the break on the weekends, like you said. So I have my little food Instagram that Noel's been seeing. Just keeping that for fun. And then just utilizing the resources, especially on the Oxford campus. Oh, I'm sure the Jackson campus. But during the undergrad years of Oxford, we have the tutor sessions and the supplemental instruction sessions, all for free, included with everything that we have available, and all the resources that you can just pop into a faculty office. There's many faculty offices that just pop into their offices all the time and just talk to them and get advice. I'm always looking ahead to other opportunities and positions that I can get into. So I'm always like popping in, and just they're always welcome with their open doors. So that's one of my favorites and advice that I have for people.
Yeah, and I think you bring up such a good point in terms of utilizing your resources. I think, there, like I said, in terms of finding other ways to identify yourself, like also utilizing like other students, like you said, in terms of network, like talking to older students, seeing, what their experiences were like, and joining those student organizations and clubs, or other things that might be pharmacy related or might not be pharmacy related, or maybe picking a few, being like, oh, I want one pharmacy organization that's going to be like my pharmacy organization, but then I'm also going to join, like, I don't know, a club sport, or
or cultural organization,
cultural or fraternity or sorority or whatever it may be. So I think things like that can build other skills in other areas, like leadership, or those soft skills that you can't really learn from reading a textbook or taking 3 exams. Like those skills you can always work on outside of the classroom. So yeah, I think you have some good advice.
Awesome.
Well, I think that's about our time today. Thank you both for being a part of this conversation. I've definitely enjoyed it, and I hope that our students will too.
Thank you.